Types of fever in pathology. What is fever? Fever is when your body temperature is higher than normal. Your normal body temperature can vary depending on your age, gender, activity level, and time of day. Usually, it is around 37 degrees Celsius, 98.6 degrees Fahrenheit, when measured by mouth. Fever is not a disease by itself, but a sign that your body is fighting something, like an infection or inflammation. What causes fever? Fever can be caused by many things, such as 1. Viruses or bacteria that invade your body and make you sick. 2. Heat exhaustion or heat stroke when you are exposed to very hot weather or exercise too much. 3. Inflammatory conditions that make your immune system overreact, such as rheumatoid arthritis or lupus. 4. Cancerous tumors that grow and spread in your body. 5. Drugs or medications that affect your body temperature regulation. What are the types of fever? There are different types of fever, depending on how your body temperature changes over time. They are 1. Intermittent fever. This is when your body temperature goes up and down between normal and fever levels over the course of a day. 1. You may feel hot and cold at different times. 1. This type of fever is common in malaria, tuberculosis, and some viral infections. 2. Remittent fever. This is when your body temperature stays above normal throughout the day and does not go back to normal. 2. You may feel hot all the time. 2. This type of fever is common in bacterial infections, such as pneumonia or typhoid. 3. Continuous or sustained fever. This is similar to remittent fever, but your body temperature does not change much during the day. 3. It stays high and steady. 3. You may feel very hot and sweaty. 3. This type of fever is common in urinary tract infections, endocarditis, and some cancers. 4. Hectic fever. This is when your body temperature goes very high and then very low in a short period of time. 4. You may have chills and shivering followed by sweating and flushing. 4. This type of fever is common in septicemia, abscesses, and some cancers. 5. Relapsing fever. This is when your body temperature goes back to normal for a few days and then rises again. 5. You may feel better for a while and then worse again. 5. This type of fever is common in some infections that come and go, such as Lyme disease or brucellosis. How do you measure fever? You can measure your body temperature using a thermometer. There are different kinds of thermometers that you can use in different parts of your body, such as 1. Oral thermometers that you put under your tongue. 2. Ear thermometers that you insert into your ear canal. 3. Forehead thermometers that you swipe across your forehead. 4. Armpit thermometers that you tuck under your arm. 5. Rectal thermometers that you insert into your anus. The most accurate way to measure your body temperature is by using a rectal thermometer, but it may not be comfortable or convenient for everyone. The oral thermometer is the most commonly used one, but you need to wait at least 15 minutes after eating or drinking before using it. The ear and forehead thermometers are easy to use, but they may not be very accurate if you have earwax or sweat on your skin. How do you treat fever? The treatment of fever depends on the cause and severity of it. Some general tips are: 1. Drink plenty of fluids to stay hydrated and prevent dehydration. 2. Rest as much as possible and avoid strenuous activities. 3. Wear light clothing and keep your room cool and well ventilated. 4. Use a fan or a wet cloth to cool down your skin. 5. Take over-the-counter medications such as acetaminophen, Tylenol, or ibuprofen, Advil, to lower your body temperature and relieve pain or discomfort. 6. Seek medical attention if your fever is very high, above 40 degrees Celsius or 104 degrees Fahrenheit, lasts longer than 3 days, or comes with other symptoms such as rash, headache, stiff neck, confusion, breathing difficulty, or vomiting. Here are some latest research findings with easy language about types of fever. 1. A study from 2022 found that fever therapy, which means using drugs or cooling methods to lower your body temperature, does not help you live longer or prevent serious problems when you have a fever. 1. The study looked at 42 trials with more than 5,000 people who had fever from different causes. 1. The study also found that fever therapy does not affect your quality of life or cause more minor problems. 2. A study from 2016 explained how fever works in your body and why it can be good or bad for you. 2. The study said that fever is caused by chemicals called cytokines that your immune system makes when it detects something harmful, like germs or damaged cells. 2. These cytokines tell your brain to raise your body temperature to fight the infection or inflammation. 2. However, if your body temperature goes too high or stays high for too long, it can damage your cells and organs and make you very sick. 3. A study from 2020 gave some advice on how to manage fever in babies and young children. 3. The study said that fever is common in children and usually goes away by itself. 3. However, sometimes fever can be a sign of a serious infection that needs medical attention. 3. The study suggested some ways to tell if your child has a serious infection, such as looking at their age, behavior, appearance, and other symptoms. 3. The study also recommended some ways to measure your child's temperature, keep them comfortable, and when to give them medicine or take them to the doctor. 4. A study from 2021 compared fever therapy with no fever therapy in adults who had fever from different causes. 4. Fever therapy means using drugs or cooling methods to lower your body temperature. 4. The study found that fever therapy did not help people live longer or prevent serious problems. 4. The study also found that fever therapy did not affect people's quality of life or cause more minor problems. 5. A study from 2023 looked at how people react to the COVID-19 vaccine. 5. The study found that some people may have symptoms such as fever, headache, or tiredness after getting the vaccine. 5. The study also found that these symptoms are more likely to happen in younger people, women, and people who have had COVID-19 before. 5. The study said that these symptoms are not serious and show that the vaccine is working. 6. A study from 2023 used devices called accelerometers to measure how cows behave when they have fever. 6. The study found that cows with fever move less, lie down more, and eat less than normal cows. 6. The study also found that cows with fever show signs of pain, such as licking their legs or rubbing their heads. 6. The study said that these devices can help farmers and veterinarians detect sickness and pain in cows and treat them better.